Good evening, everyone. I hope you can hear me well. I am a representative of the pharmaceutical company AlivitPharm. AlivitPharm is a pharmaceutical company based in Herzegovina, in a small town called Ljubljana. I would say that the key word for our pharmaceutical company is synergy. Why synergy? Because we are the only pharmaceutical company in the world that incorporates the synergy of fermented garlic extract and medicinal herb extracts from our region in its products, supported by numerous clinical studies highlighting their benefits for human health. Why do I say, from our region, and why is that important? I would say that this refers to the medicinal herbs that our grandparents have been using for decades to treat various medical conditions or indications. This means that the body will not perceive them as foreign substances, making them compatible with our genetic makeup. Our synergy, the therapeutic synergy found in our products, is evidence-based synergy. We have proven our synergistic effect by testing the antioxidant potential, where the antioxidant potential of the extract mixture is greater than the sum of the antioxidant potentials of each individual ingredient. The uniqueness of our pharmaceutical company lies in the fact that we independently grow the raw materials under controlled conditions. Additionally, through a series of highly advanced pharmaceutical technological operations, we create the products that we present to you through our webinars. That's not all. We are the only pharmaceutical company in this region that packages this traditional method of treatment, this therapeutic, proven synergy, into soft gelatin capsules. Why soft gelatin capsules? Because they enable high bioavailability of the oil extracts they contain. All these previously mentioned aspects have resulted in the highest quality standards, such as GMP, Halal, and HACCP, which testify to the quality of our products. Our vision is to promote healthy lifestyle habits, support health prevention, and aid in the treatment of various medical conditions as a supplement to chronic therapies. It is my honor tonight to introduce our esteemed speakers, Dr. Daniela Radijkovic, internist, endocrinologist, and founder of the Naja Medic Polyclinic, and Dr. Alexander Supik, urology specialist at the Clinical Hospital Center Zvezdara. They will discuss the benefits of fermented garlic and medicinal herb extracts on the urogenital tract. Thank you.
Good evening, everyone. I hope you can hear me well. You might wonder why I, as an endocrinologist, am speaking about this topic, especially since my colleague, a urologist, will be joining us a bit later. Let me just say one thing, I am not just an endocrinologist, I am also a practitioner of complementary medicine. During this lecture, I will explain the essence and innovations in medicine. You are aware that our Western medicine is unparalleled when it comes to acute diseases. However, it has fallen short when dealing with chronic diseases, which are experiencing epidemic growth worldwide. The United States, for instance, is one of the leading nations in terms of alarming statistics, with nearly 6 out of 10 people having one chronic disease, and of those, 1 in 4 has 2 or more chronic conditions. To begin, let me share some information. If you recall, we were taught that autoimmune diseases were rare. However, today, medicine recognizes over 100 types of autoimmune diseases. The most common include cardiovascular diseases, cancer, neurodegenerative diseases, and diabetes. The World Health Organization, as early as the 1980s, proposed that leading countries develop strategies to integrate all available knowledge to prevent and mitigate the epidemic of chronic diseases. This marked the birth of what is now known as integrative medicine, or complementary medicine. It is essential to understand that this is not alternative medicine. Alternative medicine refers to methods once used by non-medical practitioners as alternatives to Western medicine. Complementary medicine, on the other hand, applies knowledge from traditional practices such as homeopathy, aromatherapy, quantum medicine, and many others, which are practiced by doctors trained in these methods. These practices are recognized by the Serbian Medical Society and integrate these approaches to holistically assess a patient. The most advanced type of medicine today is functional medicine. Unlike Western medicine, which primarily focuses on treating symptoms, functional medicine addresses the root causes of diseases. This holistic, complementary approach identifies that the origins of chronic diseases lie in poor nutrition, stress, genetics, digestive issues, lack of sleep, toxins, and trauma. Now, I will explain the core principle of how cells lose their integrity and create a predisposition for disease. The most recent development is an entirely new branch of medicine called psychoneuroendocrinoimmunology. It connects 7 fields of medicine: psychiatry, psychology, psychotherapy, endocrinology, immunology, and others. This branch emphasizes that all organs in our body are interconnected and communicate with one another. The brain is the central organ where all information is processed. Our brain's amygdala and centers determine how we perceive each piece of information, which directly influences whether we remain in balance and healthy or succumb to stressors that we cannot adequately process. These unresolved stressors can trigger postsynaptic and synaptic disorders, where prolonged emotional or mental conflicts, especially those involving negative emotions, become substrates for changes in the hypothalamus and pituitary gland. This imbalance in hormones and neuropeptides then affects the adrenal glands, leading to disruptions in the secretion of cortisol, adrenaline, and norepinephrine. This, in turn, triggers cytokine production and the onset of inflammatory processes, which eventually alter the microbiota. I will elaborate on this later. The microbiota, often referred to as our second brain, located in the gut, further exacerbates the imbalance through feedback loops, affecting serotonin levels and other hormones. How we perceive ourselves and our environment perpetuates this vicious cycle, which can be challenging to break. You know that until about 10 years ago, very few people talked about oxidative stress or understood what it was. Today, however, we know that it is the primary material conformation of the onset of any disorder. On one side, we have antioxidants, such as vitamins A, C, and E, as well as enzymes of oxidative stress, superoxide dismutase, glutathione peroxidase, and catalase. If these enzymatic processes are functioning normally and we have sufficient antioxidants in the body, we can mitigate the formation of excess free radicals, which naturally occur as part of respiratory and metabolic processes. Unfortunately, due to numerous endogenous and exogenous factors, including high levels of pollution in air and soil, a lack of vitamins in our diet, and insufficient antioxidants, we are creating an imbalance. This imbalance is characterized by an overproduction of free radicals and an inability to replenish antioxidant potential, leading to DNA damage and cellular harm. Until recently, genetics was considered the root cause of everything. However, today we confidently say that what we inherit genetically accounts for only 20%, while epigenetics and lifestyle factors such as nutrition, physical activity, sleep, thoughts, and emotions define the rest. It is now clear that these epigenetic changes influence whether or not a genetic error will ever manifest. For instance, even if we inherit a genetic predisposition, it may never activate if our lifestyle is healthy. Unfortunately, in the aftermath of the pandemic and the past 4 to 5 years, we are seeing conditions emerge much earlier than expected. People who might have developed type 2 diabetes in 10 to 15 years are now diagnosed in their 30s or 40s due to chronic inflammation and widespread corticosteroid use. Alarmingly, even children are developing diabetes due to significant changes in their microbiota and severe chronic inflammation within a short period. Chronic inflammation underpins all these processes. While inflammation itself is beneficial and part of the body's natural defense, historically described as "give me an infection, and I'll clear out the system," this only holds when the body is healthy and has sufficient antioxidants. Under such conditions, inflammation subsides naturally, and balance is restored. However, today, most of us exist in a state of chronic inflammation, which is undoubtedly a consequence of poor diet, vitamin and mineral deficiencies, and increased oxidative stress. This chronic inflammation lies at the root of many chronic diseases, such as cancer, neurodegenerative diseases, which are now appearing much earlier than previously thought, asthma, chronic obstructive diseases, and autoimmune diseases. What can we do to prevent this? That's another topic entirely. Lastly, I'd like to mention a molecule called pathogen-associated molecular pattern, PAMP. It serves as a gatekeeper in the gut, determining whether something is beneficial or harmful to us. Unfortunately, in most autoimmune diseases, this system has become disrupted. It is now believed that PAMP, which should accurately identify what is good or bad for our body, has lost its function. As a result, every antigen that comes into contact with the mucosa of the small intestine is perceived as harmful or stress-inducing, even when it isn't.
Microbiota. You already know how much is being said about microbiota, that it constitutes 80% of our immunity, and that all the hormones secreted in the body, including those secreted in the brain, have their receptors in the brain. Today, we know that their activity is predominantly created in the gut, such as serotonin. As an endocrinologist, I was fascinated to learn that, especially in children newly diagnosed with type 1 diabetes, bacteria appear in the microbiotic culture, essentially beneficial saprotrophic in the gut, that can secrete insulin for a certain period and, in this way, help prevent complete damage to the islets of Langerhans in the pancreas. Thus, microbiota is our health. All the changes we've made, such as consuming large amounts of processed foods, the lack of dietary fiber, which should be generated and recultivated, excessive use of medications, and a high intake of antibiotics, have altered our microbiota entirely. The microbiota of our population is different from that of Japan, China, or anywhere else. Every individual has a unique print of their bacteria. In the future, a large number of new medications will be developed to address exactly what each person is missing and what can be added to restore balance in the body. Today, the leaky gut syndrome is considered the foundation of most inflammatory conditions in the body. You know that the epithelium of the small intestine is literally made up of just one layer of cells. It's a single cell-thick layer, and all these external factors can damage it, causing this layer to break down. As a result, antigens end up beneath the gut lining, triggering interleukin-6, tumor necrosis factor alpha, and other inflammatory factors, which lead to the progression of inflammation. This inflammation isn't of high intensity, but rather a slow, smoldering infection. I often tell my patients, your fire is burning, but you don't have a full-blown blaze. You have a small flame that can occasionally and gradually spread to other organs. Many people noticed this after COVID-19, following extensive use of antibiotics and corticosteroids, which led to functional digestive disturbances and the activation of putrefactive bacteria. Quite simply, our stomach, small intestine, and large intestine are the foundation of our health. If the digestion process doesn't work, everything falls apart in a cascade reaction. This is precisely the essence of modern functional medicine, addressing functional imbalances long before any disease manifests. Unfortunately, it is challenging to define these imbalances. There are no available tests for this in Serbia, although such tests exist in the US and are quite expensive. Here, we rely purely on logic, trying to assess through simple food digestibility tests whether people are digesting food properly and whether this could be the basis of existing disorders. We aim to determine whether it might be the foundation for further damage and whether we can stop or prevent it in the future. Dysbiosis. Dysbiosis underpins many of these health issues. Simply prescribing probiotics is insufficient. They must be combined with prebiotics for a synergistic effect. Probiotics provide live cultures while they're consumed, but once intake stops, the benefits cease unless conditions in the gut foster bacterial colonization. Prebiotics, such as dietary fibers, are essential for this. Although testing for dysbiosis is difficult in Serbia, indirect evidence, such as bloating, gas, and digestive issues, combined with patient history, often suggests its presence. Immunomodulation. A completely new parameter. In the past, we were taught that for autoimmune diseases, we must either suppress the immune system or enhance it. However, today, the understanding is that we should do neither but instead modulate the immune system. Modulation means restoring balance. This primarily relates to NK, natural killer, cells and T lymphocytes. The essence is that if one type of lymphocyte becomes overexpressed compared to others, immunomodulation means bringing it back to normal levels. What science has proven is that no medication can achieve immunomodulation, only plants can. Why? Because they are natural, and the pump, the molecule, recognizes plants as entirely natural, likely embedded in our DNA. It is believed that plants native to our region are especially recognized as beneficial by our bodies. This has been scientifically proven. I conducted a study before COVID-19 where we worked on immunomodulation in patients with Hashimoto's thyroiditis. We proved that the activity of NK cells is significantly higher in people with autoimmune diseases compared to those without. Through immunomodulation and targeting factors known to trigger Hashimoto's, we were able to reduce the impact. In fact, in some patients with Hashimoto's, the condition disappeared over a short period, and their health returned to normal. Because I conducted and verified this study, we are the only ones in Europe who have done so. I am delighted to explain this to you today. It's not just about mechanisms for the prostate or urinary infections, but throughout the entire body. The same plants used for one condition can apply to other inflammatory states. The body does not function as isolated organs. Instead, all organs communicate with each other. The effects of immunomodulation occur at the cellular level across the entire organism. Regeneration and prevention. Unfortunately, we doctors are often eager to see quick results, but the process of regeneration, which was never taught to us in medical school, is now understood to be an entirely different phenomenon. It is a new field of science that explains the mechanisms by which the body fights pathogens on its own, how it manages this process, and how much time it needs to regenerate. At the level of each cell and organ, there is a specific time frame, as seen in this example, detailing how many days, months, or years are required for a cell to regenerate. However, to initiate the regeneration process in the body, all necessary factors must be present: vitamins, minerals, trace elements, antioxidants, and the absence of stress. This is nearly impossible for today's individuals, who live under chronic stress. We need support systems to help us both prevent disease and halt the progression of existing problems. I want to emphasize one point. We will discuss both diseases and prevention here, primary and secondary. Primary prevention applies to healthy individuals who can use these therapeutic models to maintain health. For those with chronic conditions, the focus is on preventing further complications. Regeneration requires time. The minimum duration for any supplement or treatment to show effects is 3 months. Why? Because at the level of oxidative stress and its enzymes, it takes at least 90 days for effects to reflect on enzymes such as superoxide dismutase, glutathione, or catalase. You may not know this, but blood analyses are now available, conducted by our Faculty of Pharmacy, which allow us to accurately assess an individual's oxidative status. These tests measure the levels of oxidation in the body, total antioxidant potential, the potential of individual antioxidants, pro-oxidant potential, the levels of free radicals, and their individual ratios, including glutathione and superoxide dismutase. These are used to evaluate a person's condition and recommend appropriate supplementation.
What is fermented garlic? The essence lies in the fermentation process. As Marco mentioned, the key aspect of this product is that the fermentation process lasts for 3 months and is conducted in specialized devices called fermenters. These devices maintain specific temperature, humidity, and other conditions, resulting in black garlic. Its active substances are 10 to 20 times more potent than those of regular garlic. What I find particularly interesting is that the fermentation was carried out using Bacillus subtilis. If you recall the old Bacticetl, a probiotic that was phenomenal, Bacillus subtilis serves as the basis for producing ribose, meaning it is the only probiotic culture that fully regenerates DNA. This means that this fermentation process provides far more than just black garlic. Through fermentation, it is known that biological activity is enhanced, and this activity stems from the conversion of phytochemical compounds. There are numerous compounds. You'll see on the next slide the list of nutrients found in black garlic. However, I would highlight 2 substances, allicin and S-L-cysteine. Allicin is a less stable compound. Its primary effects are antifungal, antiviral, and antibacterial. However, due to its chemical instability, excessive use can lead to adverse effects. The key discovery in modern medicine is the importance of S-L-cysteine, the most significant compound in garlic. It has a remarkably strong antioxidant effect and synergism. This compound can bind free radicals 10 times more effectively than garlic extract, making it highly potent. Regarding benign prostatic hyperplasia, BPH, it is much more common in the US and Europe compared to Asia. This is attributed to the higher garlic consumption in Asia, particularly in China. While garlic consumption in our region is significant, studies have shown statistically significant differences. Research mentioned here has demonstrated substantial improvement in BPH parameters in individuals who regularly consumed garlic extract. This can be explained by the antioxidant activity of minerals, vitamins, polyphenol, flavonoids, and sulfur compounds in garlic. Based on these studies, it can be concluded that garlic, due to its anti-inflammatory and antioxidant properties, finds its place as an adjunct therapy or preventive measure for BPH. For instance, I would recommend it to all patients over 50 years old as a preventive measure or as part of treatment for those who already have BPH, either alone or in combination with medications and other supplements. Regarding the anti-inflammatory and anti-cancer potential in treating prostate cancer, garlic also demonstrates effectiveness. It has been proven to inhibit malignant cell proliferation and the formation of cell migration colonies in prostate cancer. This indicates that fermented garlic can truly serve as a therapeutic agent in prostate cancer treatment. I would also recommend this preparation for patients undergoing chemotherapy or radiation therapy, as it poses no risk of adverse effects. On the contrary, it provides necessary immunomodulation to support the immune system during treatment. Bladder cancer in comparison with BCG immunotherapy. Studies on animals have shown that garlic is highly effective in treating bladder cancer when compared to BCG immunotherapy. It has a direct toxic effect on sarcoma cells, stomach cancer cells, colorectal cancer cells, bladder cancer cells, and prostate cancer cells. The effects of garlic and BCG immunotherapy exhibit many similarities. For instance, garlic stimulates lymphocyte proliferation, macrophage phagocytosis, induces macrophage and lymphocyte infiltration in transplanted tumors, causes spleen hypertrophy, promotes the release of interleukin-2, TNF-alpha, and interferons, and significantly enhances natural killer, NK, cell activity. These activities represent an effective stimulation of the immune response. Based on this, studies suggest that garlic may be useful both in prevention, by suppressing the immune response, and as an adjunct therapy for individuals undergoing other treatment modalities. Erectile dysfunction. In cases of erectile dysfunction, ED, when combined with tadalafil, garlic shows promise, particularly for patients unable to fully benefit from tadalafil alone. A study demonstrated that patients with persistent issues in maintaining improved erectile function, despite tadalafil treatment, showed improvement after incorporating garlic into their regimen. Group A received 5 grams of garlic orally twice daily, while Group B received a placebo for 4 weeks. Both groups continued taking 5 milligrams of tadalafil nightly. Erectile function was assessed at baseline and at the end of the 4th week. Of the participants, 19 in Group A and 16 in Group B completed the study conducted from May to August 2022. Group A showed statistically significant improvements compared to the placebo group. In conclusion, garlic, as a hydrogen sulfide donor, proved beneficial as an additional therapy for participants who responded poorly to tadalafil alone. As an endocrinologist, I'd like to add that the benefits of garlic extend beyond erectile dysfunction, positively affecting microcirculation throughout the body and other vascular structures. L-cysteine, a powerful antioxidant, is a key agent in combating erectile dysfunction, likely due to its antioxidative properties. Garlic also demonstrates hypoglycemic effects and enhances pancreatic sensitivity to insulin, making it suitable for diabetic patients. Fertility. Approximately 1 in 6 couples in Serbia experiences infertility. This is partly attributed to exposure to hormonal disruptors such as pesticides, phthalates, microplastics, and estrogen-rich foods, which impair sperm quality and motility. A review of 18 experimental studies, 13 assessing garlic's therapeutic effects and 5 comparing garlic to agents like adriamycin, titanium dioxide, furans, vitamin E, N-acetylcysteine, and cadmium, highlighted garlic's potential to enhance fertility and spermatogenesis, increase testosterone levels, and improve testicular structure. Garlic's antioxidative properties may contribute to these effects. A study conducted at the Narodny Front Clinic identified high levels of heavy metals in women's follicles, potentially impacting fertility. Garlic's ability to counteract heavy metals makes it a promising option for addressing this issue. Urinary tract infections, UTIs. Regarding urinary infections, caused specifically by the bacterium Escherichia coli, you know how chronic this condition can be. It has the potential to progress slowly, be temporarily resolved with antibiotics, and then quickly re-emerge. We sometimes joke about women who experience a recurrence of Escherichia coli after activities like running, as this physically disturbs the tissue and reactivates dormant spores. Today, there's a significant challenge because we don't have as many antiseptics as we used to. The development of black garlic, combined with lyophilized plant extracts, has resulted in an extremely potent preparation. The key component, allicin, has strong antifungal and antimicrobial properties, making it highly effective for urinary infections. It modulates immune and inflammatory responses. The product is a combination of garlic, lyophilized cranberry, and parsley, designed to reduce the risk of chronic infection and recurrence. In clinical practice, we see a significant number of women with such infections, especially among patients on diabetes medications. While these drugs are excellent, they have an unintended side effect of promoting Escherichia coli activity due to altered urine pH levels. The combination of this antiseptic with black garlic has proven to be an excellent treatment option, which can be used immediately during infection or later, after completing antibiotic therapy. I would recommend its use for up to 3 months, to minimize the risk of residual spores. A study evaluating the antimicrobial and anti-inflammatory effects of garlic demonstrated its synergistic effect with ciprofloxacin, a commonly used first-line therapy, in an animal model. The study involved 3 groups of experimental animals, one treated with garlic alone, another with ciprofloxacin, and the third with a combination of both. After 3 weeks of treatment, microbiological cultures and histological findings of prostate tissue showed reduced bacterial growth and improvement in prostatitis compared to the control group. These results suggest that garlic has anti-inflammatory and antimicrobial properties, as well as a synergistic effect with ciprofloxacin. Therefore, it can be administered in combination from the very beginning. Products for the urogenital tract. This comprehensive research highlights garlic's broad potential in oncology, erectile dysfunction, fertility, and urinary tract health, reinforcing its role as a therapeutic agent in diverse clinical scenarios. For the prostate, there is black garlic prostate, which is intended for adults. Take 1 3 times a day, during or after meals. It contains oil extract of the bulb and fermented garlic. What pumpkin seed oil generally provides in most prostate preparations is also present here. The only limitations for all these preparations are that caution should be exercised in individuals on anticoagulant therapy and antiplatelet therapy due to an increased bleeding time. Simultaneous use with saquinavir and ritonavir is contraindicated due to the risk of reduced plasma concentration. It is not recommended for those under 18 years old. Regarding the Prostate Plus product, it contains herb willowherb, turmeric, nettle root, and black pepper fruit, which have a synergistic effect with freeze-dried plants. It also contains zinc, selenium, and vitamin E, which is a great story related to free radicals and antioxidant capacity on one hand, and on the other hand, also for heavy metals. The limitations are the same as for all these products. For other preparations, Potent Max is recommended 3 times a day, 2 capsules during or after meals. It contains tribulus, oil extract of fermented garlic bulb, and fenugreek seed. Fenugreek increases muscle tone, improves overall condition, reduces weakness, and supports general functioning. Tribulus supports the health of the sexual organs and hormonal activity, i.e., it increases testosterone levels and sexual desire and ability. Regarding the limitations, they are the same. Caution is required in patients who are on inhibitors, hormonal therapy, and antihypertensives. As for determining the antioxidant activity of the Potent Max product, synergy in antioxidant activity was proven between the oil extracts of fermented garlic bulb, herb of the mother's tooth, and fenugreek seed and soybean oil in the black garlic product. Their mixture in a 4:3:3 ratio showed 11.08% greater antioxidant activity than the sum of the antioxidant activities of the individual extracts. This means that there is a very good synergy between them, which, in some way, reduces potential unwanted side effects. Alicept, which, in my opinion, has shown great results against urinary infections, is a combination of garlic, parsley, oregano, dandelion, horseradish, cranberry, and peppermint, which have anti-inflammatory, antiseptic effects. They increase diuretic effects, increase urine output, and have a spasmolytic effect for cramps and pain. As for the limitations, they are the same as for all other products. Of course, it must be noted for pregnant women, breastfeeding mothers, and children under 12 years old. I hope I have been clear and that you understand the essence of all this. Thank you.
I would like to thank Dr. Daniela for the excellent lecture and to say that all the preparations mentioned by the doctor are already part of clinical practice. More detailed information on this will be provided to us by Dr. Alexander Supik.
Good evening everyone. To all listeners and viewers, I would like to thank Dr. Daniela for the excellent lecture. Dr. Daniela has already explained everything, so we won't repeat too much and bore the listeners, but only based on clinical practice. As a urologist, there are numerous preparations available on the market for the treatment of prostate issues, urinary infections, erectile dysfunction, and male infertility. However, we all witness the occasional ineffectiveness of these preparations. Through urological practice, we observe an increase in prostate diseases, urinary infections, and particularly erectile dysfunction. Regarding male infertility, it has been a well-known fact for some time that a urologist once mentioned that the white race is losing the battle against infertility, which remains true. Whether it is due to diet, lifestyle, or a combination of factors, we are indeed losing the battle against infertility. In the case of prostate diseases, we all witness the rising number of prostate cancer cases, which has even become the leading cancer in the male population. The goal of these preparations, especially Prostat Plus, is not necessarily to reduce the volume of the prostate, but through all the mechanisms explained by the doctor, we aim to prevent prostate cancer, which I believe is the greatest benefit of this medication. This is an investment for the future, through long-term use of this treatment. Dr. Daniela mentioned 50 years, by the age of 50, serious issues with an enlarged prostate and prostate cancer already develop. I would advise starting this preparation even after the age of 30 or 35 to improve prostate health and prevent prostate cancer in the long run. Regarding urinary infections, we are all aware of numerous urine cultures showing resistance to all known antibiotics. Whether it is due to immunity or overuse of antibiotics, the indiscriminate prescription of antibiotics by doctors and their consumption by patients, it doesn't matter. From personal experience, I can tell you that Alicept is an excellent preparation. Even in combination with antibiotics and without antibiotic therapy, I have seen significant reductions in bacterial counts in urine cultures that previously showed resistance to all antibiotics. Thus, Alicept has proven effective. Through all these mechanisms explained by the doctor, its long-term use, with or without antibiotics, also has a beneficial effect on prostate diseases, alongside Prostat Plus. Alicept helps reduce chronic inflammation in prostate diseases. Regarding Potent Max products, its use, especially due to tribulus, naturally increases testosterone levels, enhances male strength, fertility, and erectile function. It is very significant as it works naturally in synergy with plants like fenugreek and goat's head. It is especially suitable for patients who are cardiological patients and cannot take medications that cause significant vasodilation. These patients can safely take these preparations, which is important for general practitioners to improve erectile dysfunction. Additionally, all these preparations can be combined with official medications. We can use them for diabetics, as the number of diabetics, especially in younger age groups, is increasing. Diabetics can use Ezerex as an official medication for treating erectile dysfunction, and these preparations can be combined with it. Regarding male infertility, while we cannot yet claim a significant effect, research is showing promising results. We will provide those results soon, indicating that the combination of fermented garlic with fenugreek and goat's head significantly improves sperm motility, count, and morphology. In the future, this combination will play a crucial role in treating male infertility. So, Marco, that's it for now. If there are any questions,
I would like to thank our speakers once again for the excellent lecture tonight. Thank you on behalf of the pharmaceutical company AlivitPharm. We have one question. A colleague asked whether Alicept can be taken along with antihypertensive or anticoagulant medications.
Who is the question for?
Would you like to answer, Doctor?
Yes. In my opinion, I think it is fine, of course.
Absolutely correct. Now, through practice, those who take antihypertensive medications, garlic, since we are talking about non-fermented garlic here, will actually lower blood pressure. It will have a beneficial effect. You just need to be a little more regular in measuring blood pressure, because I had a patient in practice for whom Alicept worked well, but she had to stop because it caused hypertension. So, it significantly affects blood pressure, which is why it's a good medication. However, more frequent monitoring of blood pressure is needed.
I would say that patients who are on heparin, warfarin, or acenocumarol should avoid fermented garlic, and of course, patients who have had any intervention 7 days before or after surgery should not use fermented garlic preparations. We have one more question, and then we will finish this webinar. What is the limit for using this supplement, and after how much time should a break be taken? It is recommended to use it continuously for about 3 months, and the recommended break is 10 to 14 days before resuming use.
That's right, and with Potent Max, it's important to note that it should be taken continuously for 15 days. After 15 days, a break of at least 2 to 3 weeks should be taken before it can be resumed.
That's right, we can say that even after discontinuing the use, there is no decrease in libido or energy. It's not a substitute therapy, but a natural support for the synthesis of androgenic sex hormones.
Tribulus combined with garlic is the best stimulant for male hormones.
Let me add something, for example, about Alicept or the other question, how do the supplements affect laboratory tests? The essence is that they do affect laboratory tests, especially factors like CRP and blood count, where you will see the effect on neutrophils, lymphocytes, and monocytes. You can actually assess whether you have influenced inflammation through these parameters. As with Alicept, I wouldn't give it for less than 3 months, because we need 3 months to improve the antioxidant capacity and have an effect on the spores.
Alicept, I would add, also affects the immune system.
Yes.
In chronic urinary infections of unclear cause, the issue is local immunity. A person doesn't have to feel weak or have a constant infection, they have poor local immunity. The goal of this treatment is to strengthen both the local and general immunity, thereby treating the infection.
What I said is immunomodulation. We need to modulate, to act on those lymphocytes, so they can see what is happening in the body, to reduce the effect of cytotoxic ones, and increase the regulatory ones, but we don't necessarily need to know that. The essence is that the body, through the pampas, knows how to regulate everything on its own.
And the long-term use of the Prostat Plus product. This is very important. Nothing can happen overnight. After the age of 30, 35, when according to our books carcinogenesis and growth, hypertrophy, begin. After 85, by the age of 90, biopsies will show prostate cancer in over 95% of men. There's no debate about that. Some will develop it earlier. That's bad, but after the age of 30, one should start taking this medicine. Not because of problems, but to prevent and stop the development of future issues.
I would say that's all for tonight's webinar. Once again, I would like to thank the speakers and thank the listeners.
Thank you all.